everybody, welcome back to the Dr.Rad show. I am actually really excited to talk to you guys about this today. I have done so many educational pieces, and I think it's awesome, and I hope you guys have gotten something from it. And just a big thank you right off the bat for everyone who shares this stuff. If you haven't shared it, give it a shot, see what happens. It's just free information for people. It's mostly educational, and it's just extra on my extra time, which I have almost none of, just to throw it out there. That's what I really wanted. It's what I started this whole dream off for in medicine, and so why not? I have some knowledge. I want to share it. So take it, share it, and get it out there. But today, I get to talk about something that I'm actually really interested in myself. I'd actually like to do a series on these. I'm hoping to do maybe a 2 or 3 part series, so bear with me. These are going to be topics that I think are misrepresentations in medicine or illusions that patients have about medicine. And today, we're going to talk about in order to have a good physician, can they also be nice? And the other way of saying that is, so I'm a surgeon, and there's a really good Medscape article and a couple other articles out there that says basically, can I have a good surgeon or a nice one? And I mentioned this in a couple other talks, but I never understood why you can't have both. I do understand that there are opportunity, right? Do you have an opportunity to see someone who's a good surgeon and a nice surgeon? Or would you have to travel 100 miles, right? Because if you're landlocked or you live in a very small area, it could be a problem, right? And I get that. If you're stuck in a small town and, that's difficult. That's a difficult situation. However, I would say the majority of people have an opportunity. Now, you're up against a few things, right? You're up against a doctor shortage that is significant. And not only is there a doctor shortage, there is a good doctor shortage. And then furthermore, the baby boomers are now at the age where, they are, there's a lot more of them. And when you couple that with the fact that, they're at an age where they're having a lot more medical problems now, then doctors are consumed. They're truly consumed. You couple that with the fact that, there's a push towards corporate medicine and there's less people maybe interested in going into medicine, and it just couples and it just it snowballs out of effect. So I will say that there are reasons why it may not be easy to get to a nice, kind, and good doctor. I will also say that if you happen to have one, I don't think you need to tolerate that. There were physicians of the past, and not all of them were mean by any stretch of the imagination, but it was a little bit different of an era, right? It was back in the day where information was not available. Dr. Google did not exist, and what your physician said to you, or especially surgeons said to you, was just taken at face value. It was considered, right next to the word of God, there was your doctor's word, and if they told you that this was it, then this was it. And if they told you to take this pill, 6 times a day, buddy, you did it. Doctors don't necessarily like the era that we've come into, right, where there's a plethora of information, and patients tend to gravitate towards it, and then come in and want to kind of usurp maybe their physician's thoughts and processes. Let me clarify that. I don't think the physicians dislike that there's information available out there and that patients are making themselves educated. I think what they're probably disliking is the fact that there's a lot of misinformation out there. And a lot of times you're in a world where we have less and less and less time with our patients because payment values have gone down significantly. Just to keep the lights on, primary care physicians are losing money if they spend more than 10 to 15 minutes with their patients. I think that's predominantly true. So, in a world where that happens, we're defending ourselves or answering 1,000 questions about some misinformation seen on Google, and that can be a problem. Otherwise, though, there are some really great places out there. If you go to a valid and worthy website to get your information, I think that that's very important. And I think coming into your physician and surgeon's office prepared, you've really done your research, you've thought a lot about things, you've got some great questions. I think that's important. It's important. There's a difference between having a conversation and an opinion and having an educated conversation, an educated opinion. So let's just, having said that, let's go back to what I know, which is you don't have to accept a rude or mean, for the lack of a better term, arrogant physician and or surgeon. I think that you can find both. I think they can be good and kind, and I think that that's very, very important. I think that empathetic skills have to be in place today as a physician, and I think that times have changed a lot. There's so much information available to people all the time that I think you have to cater to that, and I think that that's really, really important. So, is the opposite true? If you have a really, really nice surgeon, just seems like the nicest, sweetest person, does that mean that they're a bad surgeon? Absolutely not. And it's not even one of those things where you're swinging in one direction so significantly. You're like, yeah, but 80% of the nice guys are really bad surgeons. That's not true. That's not true. I would say that there is a confidence that builds up, and I think this actually goes for most people. Now, there's kind of the 80-20 rule. If you haven't heard of that, and you should look it up. Basically, it states that 80% of the problems are only associated with 20% of the physicians, and you can use it for anything. 80% of the money you spend is only on 20% of the items that you buy, right? And stuff like that. However, I would say that if you are lacking confidence in your skill, especially as a surgeon, then some of your mechanisms, your defense mechanisms, are potentially to be mean or rude. I would tell you that I have seen that numerous times, and I think that that's unfortunate. And I think that some people just have personality deficits, and I have seen some rude and or mean surgeons who have some excellent skills in the operating room. So I just want to say that I don't think you have to accept it if someone is being rude or arrogant with you. As a physician, I think that you can try to find another one. I think if your hands are tied and you are in a rural area and you don't have a lot of options, except for to travel 100 miles or 200 miles, or it's outside of your insurance, your insurance's reach, then can you establish a relationship that's acceptable to you with your surgeon and or physician? And that's complicated. It's complicated. It's kind of like being forced to be friends with someone you don't really like, right? But there's value in that friendship, right? And there's value in the relationship that you would have with a surgeon, even though they can be a rude or an arrogant person. What would you rather have, right? The rude or arrogant person, or the guy who's really nice to you and maybe not so good? So that is a real scenario that could happen. And I think at that point, obviously, you just accept the skill level, and you just don't have to deal with the rest of it, right? You just say, do a good job, thank you very much, and I don't need to really deal with you. I'll deal with your nurse practitioner, or someone else, hopefully. So I think that that's important. I think that there's an element of autonomy these days that maybe wasn't there in the past. And autonomy meaning that you are in control of you and your body. And I think that people don't get to just tell you what to do anymore. I think that there has been a paradigm shift in medicine. And I think that there's this concept that should be really grasped by most physicians, and it is the fact that, hey, listen, I'm here to give you my educated opinion, So for instance, I went to school for 16 years, almost 17 years after high school to start my first job. Hopefully that made me extraordinarily educated to have the conversations with my patients that I have. I try to be down to earth. I try to be, colloquial. I try to, really just remember where I came from, right? Which was the suburbs and farms of West Virginia. And I try to stay down to earth like that, middle earth, salt of the earth kind of people. And to do that, you got to kind of remember where you came from, and have an understanding that not everybody went through 16 years of school afterwards, right? So what can I do? It's kind of like someone who works in the electric power plant, or someone who works even in at the cafeteria at an elementary school. I wouldn't have the first inkling of what to do if I showed up, to work that day, right? I would rely on their experience and their expertise. And that's what you're doing with a surgeon or a physician, right? And hopefully you gain, or they gain your trust, and you gain theirs, right? Because it's a shared relationship. If you don't feel like you have that, I'd tell you to move on. I think you have options these days. I really, really do. And I think that physicians hopefully are treating patients better, and patients hopefully, to be quite honest with you, start treating doctors better, because I feel like there has also been the reverse, right? I feel like there's been a lack of respect maybe for physicians. I can assure you that the majority of them worked very, very hard to be where they are. I would say that it's not like the days of old where they made a ton of money and everybody's driving Mercedes and living in huge houses. That's not the case. They most of the time we're all coming out with massive amounts of student loan. I came out with, I'll just say, hundreds of thousands, not one, not two, more than that, thousands of dollars of debt. And that debt has an interest rate on it, right? And that doesn't go away. You have to pay that down over years, and ultimately it'll be millions. Salaries aren't anywhere where you think they are. They're not what they used to be. Don't get me wrong. Most physicians do well. They're comfortable. In fact, physicians are notorious for being very bad business people and very bad with their money. And the kind of joke is that, well, listen, we were 30 to 35 when we got out of school, and we were in all this debt, and we just wanted to start our lives. We wanted to have what all of our friends were having, for the decade before us, right? So I would tell you that, be kind. Be kind to your physician. In a world where we used to dress up to go to church, right? In a world where we used to wear Sunday's best to fly on an airplane. In a world where you got dressed up and you were on time to go to a physician's office, I would tell you, not everybody follows those rules anymore. And I'm not saying that it's necessary. You can show up in my office in flip-flops and your worst ragamuffin dress. I don't care. But be kind. And I think that that's important. And I think the physician should be kind to you. So that's just the first part of kind of my thoughts on kindness being shared between the physician and the patient. And I think that that's super duper important. And I will say it again. I don't think you need to compromise. I don't think to have a good physician or a good surgeon that they need to have bad manners. I think that you can have both. And I think you should hold out for it and or search for it. So have a great day, and I'll end it there.